Okay, the liver. The liver is in. I love that squirrel. The liver is in the right upper quadrant of your abdomen. So like right up here below your lung. And it's a big guy. It's a liver. You've probably seen livers from slaughterhouses. You know how big they are. Anyway, the liver's job is to detoxify chemicals that you have to take in your diet. And also it clears up the blood, cleans it up, and takes care of dead red blood cells and other dead cells. And it makes bile acid for digesting fat. That's what the liver does. Well, the liver becomes inflamed the same way that your body fat, the adipose tissue, that stuff hanging from your belly, your buttocks, or your thighs, that body fat. It becomes inflamed, similar to body fat, except body fat is more designed to take these fat overloads. Good grief, these are cells that their purpose is to stuff them full with fat. You realize as you get older, you don't grow new cells. You don't grow new fat cells. You just take the ones that you were born with and you stuff them fuller with fat. Anyway, fat cells can tolerate all this fat better than other body cells go. But the liver, it gets stuffed with fat too, just the same way. Insulin forces fat into fat cells and into all kinds of cells in the body. Forces glucose into the cells in the body too. It does both. So anyways, you get this fat stuffed in the liver, and you develop some insulin resistance. In this particular slide, they talk about how they believe that fatty infiltration of the liver also involves damage to the pancreas. I don't know that that's the case, except that it may be more likely that if you have type 1.5 diabetes, you are a sicker person, and you could, I guess you could blame it on losing some pancreatic function, but it's not necessary. You can explain the whole thing by insulin resistance, the body's cells becoming resistant to insulin. So you make more insulin and stuff more fat into fat cells. Anyway, type 2 diabetics have twofold the increase in developing non-alcohol. Let's go through these letters. NA, non-alcoholic. That's what it stands for, NA. That means when you start out your question with somebody who has liver problems, is you start out by asking them, do you drink alcohol? If they do, then you should suspect the alcohol. It's the most obvious thing. But this is non-alcoholic. Non-alcohol, that's what NA stands for, non-alcoholic fatty liver disease. Now, the way you first see this is you get a blood test back, and on that blood test, you've got a bunch of stuff. Cholesterol, creatinine, BUN, blood sugar, but you also have a whole series of liver function tests. SGOT, SGPT, ALT, and AST, and there are a couple others. Anyway, there are some inflammatory markers of liver disease that go up. And so you get this blood test back and go, my goodness, look here, my liver tests are up. What could be the problem? I don't drink. I'm very overweight, and I got type 2 diabetes. Well, when you do some further testing, like we might have a biopsy done of your liver, that's very dangerous. Don't do that unless it's absolutely necessary. Or you can do a sonogram or a CAT scan of the liver, and you can see the fat. So anyway, this non-alcoholic fatty liver disease, which is just inflamed liver tissues, no permanent destruction, no scar tissue, you have to wait until you've had decades of disease and inflammation. And eventually what happens as the process of healing takes place, the inflammatory process, is you end up having scars, fibrous scars, dead tissue, well, not dead, inactive tissue. Fibrous scars replace the normal liver cells, and so you end up losing your liver function. And we call that condition cirrhosis. You can get cirrhosis from alcohol, you get cirrhosis from fatty infiltration of the liver. Same cirrhosis. Same loss of liver function, same problems you run into, whether it's caused by alcohol or fat. Except you got additional problems with alcohol and additional problems with eating a high-fat diet. Anyway, that's how you get it. It's no more complicated than that. You just get over fat, and fat goes all through your body. On your neck, you remember the double, triple, quadruple chin? Okay, ears seem to get fat on some people. Your buttocks, your thigh, your abdomen, you stick all this fat. When I used to be in surgery, now most of you know that I spent my 4 years in medical school, working as a surgical tech. I was a surgical nurse. Every day I went in on somewhere between 4 and 10 operations a day, handing instruments to the doctors. Of course, I got a bird's eye view, to say the least, of the inside of the abdomen. We always used to laugh when somebody would have this great big fat-filled abdomen. I remember, somebody, oh boy, look at this, look what's coming out. Watch me slice this belly open and see what comes flopping out. Big omentum full of fat. Of course, they got fat on the thighs and the hips, and they got fat every place. There's nothing special about this. All right, so anyway, this is a good looking healthy liver and a fatty liver. And research, if you look at it, says the treatment with the vegan diet is best. And I'll tell you why it's best as we go on. Efforts have been made to substitute one kind of fat for another. For example, in this experiment, they use olive oil and fish oil supplements. And they find that neither one of them improves fatty infiltration of the liver. When you switch animal fat to vegetable fat or to monounsaturated fat, olive oil. The fat you eat's the fat you wear in your liver, regardless of what kind of fat it is. Remember I told you many times, I can take a needle, I can stick it in your buttocks, thigh, or abdomen, I can suck out the fat. I can take it to the lab and I can analyze the fat and I can tell what you like to eat. If you like olive oil, you'll be full of monounsaturated fats. You like Crisco's and margarines, you'll be full of trans fats. You like fish oil, you'll be full of omega-3 fats. The fat you eat is the fat you wear. Why not? What do you expect? Anyway, you end up wearing olive fat and fish fat in the liver, doesn't decrease the inflammation. So in other words, you got to get rid of all the fats in the diet to correct this problem. Okay, low carb diets. If you do this literature research, and I just did one before we started on the show, because I had some questions in my mind, you see whether or not a low carb Atkins type, carnivore, keto type diet will correct fatty infiltration of the liver. And it does. Anything that causes weight loss causes fat to come out of your body fat and your liver fat. So low carb diets, they advertise, are effective at treating because of the weight loss. Some of these articles have tried to invoke some special thing about the fat that they use. And how, I don't know. It's just nonsense. It's the weight loss that results in more fat coming out than going into either your body fat or your liver fat. Anyway, you can do it with a low carb diet. Why don't you want to do it with a low carb diet? Here are 4 major reviews. You should memorize these. You should get these studies. They're all free on the internet. Anybody that comes up to you and says they're on a low carb, keto, Atkins, carnivore kind of diet, show them these. These are review studies that looked at multiple studies. Animal low carb score was associated with higher all-cause mortality. Low carb or high protein diets used on a regular basis are associated with increased risk of cardiovascular disease. I mean, where do I have to read the dangers of these things to you? Low carb diets are associated with a significant higher risk of all-cause mortality. These are some of our best journals in the world. PLOS 1, British Medical Journal, Annals of Internal Journal of the American Heart Association. These are the best medical journals, most respected, highest impact factor of any published periodical that there is. And they give you 4 reviews of other studies, and they all come to the same conclusion: these diets will kill you. Anyway, they also make you sick, put you into ketosis. But anyway, they look at the dates on these studies: 2010, 2012, 2013. I put them in chronological order, 2014. You say, well, Dr. McDougall, this is 18-year-old research. It just can't be true. I'm sure they figured out that eating all those pigs and cows is good for you. 2023 just came out. A guy named Mercola. I don't know if you know him or not. He's a blogger who's been around for 20, 30 years. And I haven't had much contesting with him, but a little bit. He was a strong promoter of low-carb diets. Okay. And as a result, he told people to eat the Atkins diet all these years. Well, Mercola MERCOLA. Is that a change of heart? It was because of this study that came out in 2023 in the Journal of Internal Medicine. Low-carb diets, low-fat diets, and mortality in middle-aged and older people. Hey, that's me. That's me. That's you women, too. Middle-aged and older people. And what they found is if you're on a healthy diet, you have an 18% reduction in risk of dying, as opposed to an 18% increase in risk of dying. It's even worse, actually. More cancer, more heart disease, more death. There's no research, there's no studies, there's no meta-analyses, there's no conglomeration of studies that shows in any way does a starch-based high carbohydrate diet cause these problems. The kind of diet that we follow causes us to have less cancer, less heart disease, and to live longer. Plain and simple, regardless of how boisterous these people are. Reminds me of politics. Anyway, then of course you can take the new shots. There's a whole bunch of shots. Mary said she didn't notice all these different names for these shots, but they're all derived from the Gila monster venom. Gila monster is a reptile that lives in Southwest United States. And when that little fella bites you, oh, you lose weight. Well, only for a couple of minutes, because the poisoning only lasts a couple of minutes. Nausea, vomiting, diarrhea. Hey, where else do you hear about nausea, vomiting, diarrhea? Oh, you read the product inserts on these drugs, and they tell you that the desired side effect is nausea, vomiting, and diarrhea. They work by making you sick, by causing you to have some derivative of reptile poisoning. What they did is they took the venom and they just manipulated the molecular structure to make the poisoning last for a day or a week. And then they sell it to you as products, such as Mounjaro and Ozempic. Okay, so you can buy drugs. Let's see some of the downsides of buying all these drugs. Here's the Gila monster. Cute little guy, isn't he? Anyway, it's the lower jaw that has the venom. And he only clamps on you for a couple of seconds and then he lets go. But look at the side effects. The bite from the Gila monster is swelling, intense burning pain. You'd expect that from a bite, wouldn't you? Vomiting, dizziness, weakness, rapid heart rate, high blood pressure, faintness, excessive perspiration, chills, and fever. Yeah. The problem with trying to cure fatty infiltration of the liver by this means of weight loss, remember, any means of weight loss will cause the fat to come out of the liver. Why not? The fat leaves. So look at, these are the studies. This is representative of what happens when you take these GLP-1 agonists, Ozempic, et cetera, Mounjaro, et cetera, Wegovy, et cetera. What happens is this. This is an actual chart from one of the research papers. And what you see is the light gray line up there is the placebo, the control group. Okay, the control group got instructions to reduce the calorie intake by 500 calories a day and to exercise. And you see by that recommendation, light gray line, that the control group got about a 2-3% reduction in weight over the period of time that lasted 68 weeks. And then you see the dark line, which is the GLP-1 agonist, the Ozempic. And you see a really nice drop in weight. Looking at the percent of body weight that reduced to 2%, 4%, 6%. You finally get out to about 20%. 20% of your body weight, that's a lot of pounds, but not that much. It's only 37 pounds when you look at their baseline. See the bottom left-hand corner? This is the baseline. This is the baseline weight that they started with. So if you started with a 233-pound on average weight in these subjects, and you figure out what their weight loss is, what you find is they've lost 37 pounds in 68 weeks, and it cost them $17,000. And then the weight loss stops. Why does it stop? Because your body wants to survive. You see, you've got this chronic reptile poisoning. Go on. Okay, it's going on. It's keeping your appetite low, keeping your food intake low. It's giving you nausea and diarrhea and vomiting. How are you supposed to feel good about eating when you suffer from diarrhea, nausea, and vomiting? Huh? They talk about this constant song of hunger that keeps going on, and this shuts it off. Well, no, it makes you sick. That's what happens. Nausea, vomiting, diarrhea. Anyway, the body says, okay, we get down here to 68 weeks. All right, you've lost some weight, but body, if you don't do something, you're going to die. And so what happens is it finally gives up. It won't undergo any further weight loss. It goes on to a plateau at 36 weeks, and you stop losing weight. In all the studies done, they reach a plateau. You lose no more weight after 36 weeks. But if you stop the drug, you'll regain your lost weight. Now, is that the way you want to cure fatty infiltration of the liver? You can have various bariatric surgeries. You'll lose weight. Any reason you lose weight. Or it doesn't matter. Just stop eating. Have your teeth wired together. Infect yourself with various bacteria and amoeba that make you chronically sick with nausea, vomiting, and diarrhea. Hey, maybe we can get a new drug, which would be the toxins from Shigella bacteria. I bet they've tried that. The drug companies have tried that. Shigella bacteria make an extremely potent toxin. I bet you could get 2 or 3 times the weight loss and probably delay the plateau by giving them Shigella toxin. That takes me back a few years, but I'm pretty sure Shigella is a very poisonous bacterial toxin, which would probably really good for weight loss. Anyway, or you can lock yourself up in prison. I don't care. How you stop eating, you will cure fatty infiltration of the liver. Or you can take cancer chemotherapy drugs, which cures lots of stuff, except for the cancer, except for the short life. But it lowers cholesterol. If you go on chemotherapy because you stop eating, your blood pressure comes down, your blood sugar comes down, your cholesterol comes down. What doctor would brag about a weight loss program based around cancer chemotherapy? Ladies, gentlemen, come on and see me. I was treating breast cancer and colon cancer in the past. Now I got all these drugs. So I figured out these chemotherapy things don't work. So I got all these extra drugs. Why don't you come and see me? I'm going to change my practice from an oncologist. I'll be a weightologist, an obesityologist. I don't know what they call them. Brand new weight loss program. You don't have to waste all those chemotherapeutic drugs that you were ready to throw in the trash. You can use them. Okay, or you could do this. You could recognize the hunger drive as being correct. You can recognize the stomach as being the right size. You can recognize your intestinal tract as being the proper length. If you eat a starch-based diet, you're never hungry. You can eat as much as you want. You can eat as often as you want. I don't care. And don't tell me you're going to gain weight on rice or potatoes. This is a figment of your imagination. I've been doing this for 47 years, and I've been challenged by a whole bunch of people who think they have the worst eating disorder in the world. And if I sat them down in front of a bushel basket full of potatoes, they'd gain weight. Well, I've challenged a few of them along the way, and you know what? They never gain weight. So don't tell me you can't solve the problem by eating the right food, because I know you can. And what do I offer as evidence? I offer evidence of populations of people throughout history who've lived around the world, who've lived on starch-based diets. Like, for example, the Chinese, published in JAMA in the year 2013, was the incidence of type 2 diabetes in China. And what they said in there is before 1980, fewer than 1% of the population had type 2 diabetes, and obesity was virtually unknown. Do you think those people had fatty liver disease? No. They ate as much as they wanted. They fought battles. They did athletic events. They had babies. They worked their jobs. They did everything just eating. The food is meant to eat. Your hunger drive is not wrong. Get over it. You do not overeat. Your stomach was not designed too big for your body. You're not, well, you may be psychiatric and emotionally impaired. I'm not going to say you're not. But that's not the cause of your weight. It's not a lack of good thoughts, folks. Because I'm sure you spent hours and hours trying to bring up those good thoughts, and not a pound was lost. Anyway, there is rightness in nature. There is correctness. Things ought to make sense. And the only thing that makes sense to me is that if you match the human being with its proper environment, in other words, food, you'll get the most out of the body. You'll get it looking, feeling, function at its best. That's what I think. Anyway, don't let anybody get you all excited about fatty infiltration of the liver. Just ask them, do you drink alcohol? If they say no, then you say, well, then you got to fix your diet. You probably notice they're type 2 diabetic and they're overweight, and so all kinds of things. Let this not be a problem for you in the future or any reason for confusion. This is simple stuff.